Hello all, today we are going to see about interesting topic regarding an antipsychotic drug. Myself Angel, working as Assistant Professor, Mental Health Department, ES College of Nursing. First, we will see the introduction about the antipsychotic drug. First, antipsychotic drug agents are the one type of psychotropic drugs. Antipsychotic agents are also known as neuroleptic and major transglydes are D2 receptor blockers, anti-schizophrenic drug or phenothiazines. These groups of drug has a major clinical using in the treatment of psychosis. What is meaning of psychosis? Is the state in which a person ability to recognize reality, to communicate and relate to other is severely impaired. And antipsychotic drugs are able to reduce psychotic symptoms in a wide variety of conditions, including schizophrenia, bipolar affective disorder, psychotic, depressive, and drug-induced psychosis. They have also been termed narcoleptics because they suppress motor activity and emotionality. These drugs are not a cure. Psychotic disorders are lifelong and it's preferable to prevent the psychotic episodes than to treat them. Next, we will see the definition of antipsychotic drug. Antipsychotic drugs are a class of medicines. It is used to treatment of psychosis and other mental and emotional condition. Next, classification of antipsychotic drug. There are two major classification of antipsychotic drug. First one is typical antipsychotic, another one is atypical antipsychotic drug. Typical antipsychotic drug, it is the first generation of the antipsychotic drug. It will cause the more side effect of neurological. So we should not use that much of typical antipsychotic drug nowadays. First, we will see the typical antipsychotic drug. First one is phenothiazine. The classification of chlorpromazine. The dosage of drug 300 to 150 mg per day. And thioxanthines, flufenazole classification. Example of drug. The dosage of drug 3 to 40 mg. Third drug is butyrophenones. For the example of classification, haloperidol, the dosage of drug 5 to 10 mg, administering the daily. Next, diphenylbutyl, the classification of this drug, pymoside, dosage of drug 4 to 20 mg. Fifth drug is pybridinus, fenflurazole. For the administration of drug dosage is 20 to 60 mg. Next, go to the atypical antipsychotic drug classification. Atypical antipsychotic drug or second generation of classification. It is cause the less amount of side effects. So we are mostly use this type of antipsychotic drug. The example of atypical antipsychotic drug, first clozapine, the dosage is 50 to 450 mg. Risperidone 2 to 10 mg dosage. Olanzapine 10 to 20 mg. Quetiapine 150 to 750 mg. Ziprasidine 20 to 80 mg. These are all the classification of antipsychotic drug. Next, we are going to see about the indication of antipsychotic drug. Antipsychotic drugs are mainly used in the treatment of acute or chronic psychosis, particularly when accompanied by increased psychomotor activity. We will see the one by one. Organic psychiatric disorder, for the example of delirium, dementia, delirium tremens, and etc. In this case, we are using antipsychotic drug. And functional disorder. Functional disorder, for the example of schizophrenia, schizoaffective disorder, and also we are used in delirium, delusional disorder. Next, mood disorder, anemia, major depression with psychotic condition only we should use the antipsychotic drug. Next, childhood disorder. For the example of attention deficit, hyperactive disorder, autism. Next, neurotic and other psychotic disorder. For the example of anorexia nervosa, incredible obsessive compulsive disorder, disabling anxiety. In this case also we are using or administering the antipsychotic drug. Medical disorder. For the example, Huntington chorea, nausea and vomiting, eclampsia, heat stroke. Next we are going to see about the pharmacokinetic. Antipsychotic drugs, when administered orally, absorbed by gastrointestinal tract with uneven blood level. They are highly bonded to plasma as well as the tissue protein. They are metabolized in liver and excreted mainly through the kidneys. The elimination half-life of this antipsychotic drug varies from 10 to 24 hours. Next, mechanism of action of antipsychotic drug. Antipsychotic drugs are blocked D2 receptor acting like mesolimbic and mesofrontal region, and it is acting sedation. It's caused by alpha adrenergic blockage. Antipsychotic drugs also acting an anti-dopaminergic action on the basal ganglia or responsible for causing the extrapyramidal syndrome. It is acting atypical. Antipsychotic drugs are acting a antipsychotic, have anti-adrenergic, anti-serotonergic and anti-histaminergic action. These are all the mechanism action of antipsychotic drug. Next, contraindication. Contraindication of antipsychotic drug. Hyposensitivity. Cross sensitivity may exist among not be used when CNS depression is evident in patient with the Parkinsonism disease, liver, renal or chronic insufficiency, elderly, severely ill or respiratory insufficiency, prostatic hypertrophy or intestinal obstruction. In this case, we should not use the antipsychotic drug. Next, side effect and nursing implication. Anticholinergic effect, it will cause a dry mouth. During the time, we will providing the sugarless candy to the patient, ice cream and frequent sips of water we should administer, and strictly oral hygiene we should follow. Next, blurred vision. In patient having a blurred vision means we should subside within a few minutes. Do not drive. Clear small item from pathways. And main side effect is constipation. Increase the fluid, and we should administer the high fiber rich diet like cucumber, banana, next papaya. It will helping for constipation. Increased physical activity, it is also prevent the constipation. Next, urinary retention. The nurse should monitoring input and output shot. Reported difficulty while urination. Gastrointestinal tract. If patient having a nausea and vomiting, administer fruit juice and consent must be diluted with other liquids. Skin rashes also will happen. So during the time, reported appearance of any skin rashes, avoid spilling of liquid, consent on skin. Next, sedation. Administer drug at bedside. We should not allow the patient in alone. Don't drive or work while after using sedatives. We should administer low dosage of drug. Next, orthostatic hypertension. In this, rise slowly from a lying and sitting position, monitoring the BP and vital signs, and document also. Report if any changes. Next, photosynthesis. Wear protective sunscreen, clothing and sunglasses while spending time outdoors. It will helping for photosensitivity. Next, weight gain. A weight mission alternate days and calorie control diet providing an exercise instruction. And reduction of seizure threshold. Close observation of the patient with history of seizure. Next, ninth one is agroneurosites. Relatively rare, with most of the antipsychotic drug usually occur within a first 3 months of the treatment. Observe for symptoms of score, throat fever and malaise. Monitoring the CBC if symptoms is appear. Next, the major side effect of antipsychotic drug extrapyramidal syndrome. The first one is pseudo Parkinsonism. Otherwise neuroleptic induced Parkinsonism we called as. Next, what is the neuroleptic induced Parkinsonism means? The patient having a tremors, guilt and drooping of mouth, rigidity. And second one is extrapyramidal syndrome, akinesia, muscular weakness. Symptoms may appear 1 to 5 days following initiating of antipsychotic medication. It occurs most often in human and elderly and dehydrated patient. So, akathisia. It is a continuous restlessness and fatigue. It occurs most frequently in women. Symptoms may occur 50 to 60 days following initiation of the therapy. Next, dystonia, involuntary muscular movement, spasm of face, arms, legs and neck. It occurs most often in men and patients younger than 25 years of age. Drive dyskinesia. It's a long-term therapy, patient are at risk. Symptoms are potentially irreversible. Drug should be withdrawn at first sign. Next one is neuroleptic malignant syndrome. It is a rare case but potentially fatal complication with neuroleptic drugs. Monitor temperature and observation of Parkinson syndrome. And onset can occur within hours or even year after during using of drug initiation. Symptoms include severe Parkinsonism, muscle rigidity, hyperpyrexia up to 107 degree Fahrenheit. Tachypnea, tachycardia, blood pressure or increased, rapid deterioration of mental status, discontinue neuroleptic medication intimately, monitor the vital signs and degree of muscle rigidity, intake and output and level of consciousness we should monitor. Thank you. This video, please subscribe and share the video.